Thanks, Ken. And Thursday is typically the time we set aside a little bit of time to talk to members of the medical community. Today, no exception. We have Dr. Borden Hooks with us this morning, a surgeon from New Hanover Regional Medical Center, here to talk to us about gallbladder surgery. And I was talking to Dr. Hooks kind of in the commercial break, saying that done a little bit of research on this, and the video that we will show you during this, to me, it's fascinating again how medical advances have come now. You're going, from what I was reading, an incision under the ribs, in a typical surgery, a 5 to 7 inch incision, to now going into the belly button to do this procedure.
Yes, indeed. Just as early as late as 25 years ago, they were doing this surgery through a large open incision on your right side. It's come a long way. It's now been reduced to several small incisions, and now using the Da Vinci robotic system, we've been able to do the surgery through a 2.3 centimeter incision tucked inside your belly button.
As far as someone that may need this procedure, let's get to these symptoms. What is going to indicate to someone that they may be having an issue with their gallbladder?
Gallbladder symptoms are very diverse. It's one of the more common problems we see as general surgeons. It can range from right upper quadrant pain after you eat, and it can escalate into some pretty serious medical problems if not taken care of. But typically, the population that we see affected most are females, have a 3-to-1 predominance, and generally it affects younger folks, 30, 40, 50-year-old folks.
Yeah, I was going to ask you if it was age specific.
It's not age specific. It can affect anyone. The most common cause for gallstones is unfortunately a lot of the American diet and what we eat and choose to eat, and sometimes that can elicit gallstone formation, which then the gallstones can cause problems.
When there are symptoms showing and your gallbladder does become symptomatic, is there a course of medicine that you can do, or does surgery very quickly become the only option?
Unfortunately not. Once the gallstones are there, there's no, unlike kidney stones where they have lasers and things to break up the stones, where the gallbladder sits, it's in a precarious spot, and so generally once they're there, if they're not causing you trouble, we don't always have to take it out. But as soon as you start having pain and other problems, you should certainly seek a physician.
And it's what we saw a little bit through the video there. The procedure itself, while it is robotic, it doesn't look all that invasive because of the size of the incision. How much of recovery time are we talking about?
Well, generally the procedure takes anywhere from 30 to 60, 70 minutes.
Okay.
The recovery time is usually an outpatient procedure, so you'll come into the hospital that day, you'll have the procedure done, and then you'll go home. And generally there's about a 3 to 5 week period where you're on activity restrictions, but for the most part you're doing daily activity living the day after the procedure.
I'm curious, and this is completely from the clinical side of things, I guess the training aspect of it. For a surgeon, when you're used to doing all this with your hands, that guy you're doing this to from a machine, how difficult is that translation for you?
Well, I think the transition from traditional open surgery to laparoscopic surgery is a big one. When you start talking about transitioning from laparoscopic surgery to robotic surgery, it becomes almost very intuitive. You go from a 2-dimensional view to looking into a monitor where you're actually having 3-dimensional view, which makes the clarity of what you're doing better. And then the robotic instruments have more of a natural hand quality as opposed to the spinning and opening and closing of a traditional laparoscopic instrument. You now have instruments that can rotate and turn like the human hand. Wow. So I think that gives you a certain advantage, certainly in tight spaces. Okay,
and and I always mention that if you do have questions about anything like this or anything medical related, you never want to ask me. You don't want to call. He said he has the white coat in the car. We believe him. He is a physician. Doctor, I appreciate the time.
Hey, thanks for having us.
Thank you again. Now